Hello again, Dr. Childress here. Thanks for joining me again. Oh my goodness, look, he has a different hat. Yes, I do. I have a different hat. That's to indicate that I'm moving slightly off the direct line that I'm talking about in the other videos. I'm still in my therapist role. I'm still clinical psychologist to clinical psychologist here, but I'm moving slightly to the side of the main line. And that's because I want to talk about the specific assessment of pathogenic parenting. So we have an attachment related pathology, and attachment pathology is always caused by pathogenic parenting. So I know one or the other parent is pathogenic, is causing the pathology. So now my differential diagnosis becomes which parent? And so I'm assessing the parenting practices of each parent to come to a diagnostic clarity as to which parent is the pathogenic parent. Now, as clinical psychologists, family therapists, how we conduct assessments is a matter of personal style, matter of personal preference, and I don't want to step on your toes regarding your prerogatives as a therapist and clinical psychologist to conduct an appropriate assessment of pathology. At the same time, I have recommendations. I have suggestions that I believe will be helpful in guiding assessment and documenting the results of that assessment. And what I'm trying to establish here is just a baseline level of assessment and documentation for attachment related pathology surrounding divorce. Now, if you go into any other field, if you go into, let's say, ADHD, there's an assessment protocol standard of practice for that. A Connors scale, a BASC, or a CBCL. You document the degree of the child's symptoms. You may even send them to a CPT test or get a test for learning disabilities, things like that. And so there's an approach to assessing and diagnosing ADHD pathology. If you go over into autism, there's an approach to diagnosing autism. You look at the various rating scales of the child's relationship. You document language kinds of things coming forward, stereotypic behaviors. So there's a whole domain of documenting, assessing and documenting attachment pathology. And that's true of anything. When you go any field, any area, the assessment and documentation of that information or that assessment is fairly structured and standardized relative to that type of pathology. So I'm hoping to get a consensus agreement on a assessment and diagnostic documentation protocol for attachment related pathology surrounding divorce. So with attachment related pathology, we are in a child rejecting a parent, we are in the domain of attachment system, which then attachment pathology is only caused by pathogenic parenting. So I've got pathogenic parenting from one parent to the other. So we're going to assess the pathogenic parenting of the targeted parent. Then we're going to assess the potential pathogenic parenting by the allied narcissistic borderline parent in a cross-generational coalition with the child. So we're going to assess each of the parents' parenting practices. So I'm going to describe my recommendation for assessing and documenting the pathogenic parenting of the potential pathogenic parenting of the targeted parent and the potential pathogenic parenting of the allied parent. And so in this particular segment, I'm going to talk about the targeted parent. Let's talk about assessing the potential pathogenic parenting by the targeted parent. In the associated session to this one, I'm going to talk about assessing the potential pathogenic parenting of the narcissistic borderline parent. So in this particular line, these are my recommendations. So these are just personal recommendations from me to you on how to assess and diagnose or document the pathology, the pathogenic parenting involved in attachment-related pathology. So let's start with the targeted rejected parent. How do we assess and document their potential pathogenic parenting? Well, I've come up with this documentation instrument. It is a documentation instrument. It is to document your clinical impressions, your clinical judgment of the parenting practices of the targeted rejected parent. And the basic structure of it is into 4 categories of parenting, ranging from abusive parent into extremely problematic parent into normal range kind of difficult parenting into normal range healthy parenting. And so there's a level, these 4 categories are on a level of severity, from really severe problematic parenting to healthy parenting. And so that's the basic structure of it. So let me walk through those 4 categories for a second. Category 1 is about abusive parenting. This is all the different various forms of abusive parenting: sex abuse, physical abuse, neglect, hostile aggressive parenting, domestic violence, all the abusive parenting stuff would be in this category, category 1 parenting. The next category, category 2, is just under that. That's extremely bad parenting, but we just sub-threshold to abusive. But each of these subcategories within the category follow through all the 4 categories. So if you have hostile aggressive parenting, physical violence, you get hostile aggressive at the next level, angry at the next level, and so the subcategories follow through each of the overall categories. So category 2 types of parenting are extremely bad. They're bad parenting. If you have a category 1 or category 2 parent, that's pathogenic parenting. Those 2 categories are pathogenic parenting, and they will produce psychopathology in the child. So then beneath that is a category 3 parenting. So it's less severe. It's maybe problematic in the same sort of way as some of the other stuff, but it's broadly normal range. I mean, parents aren't perfect, and we get along, and there's difficulties, but they're normal range difficulties. That's category 3. Category 4 is healthy, normal, maybe not normal, but at least it's healthy parenting practices. Some parents tend to be more flexible, some parents tend to be more strict, but broadly speaking, they're empathic, they're nurturing, they're loving with their children. Good, healthy parenting. That's category 4. So start with just documenting which category the targeted parents in. Are they category 1, 2, 3, 4? Where would you categorize their parenting? Categories 1 or 2 are pathogenic. If categories 1 or 2 show up, if you're checking category 1 or 2 with that, don't worry about pathogenic parenting by the allied parent. If you're getting category 1 and 2, deal with that. That's the number 1 priority. Category 1 or 2, deal with that. If you have child abuse or you have severely problematic parenting, that's your focus. Category 3 or 4, that's normal range parenting. Let's go take a look at the other parent, because we got attachment-related pathology here, and I'm not getting pathogenic parenting from this parent. Category 3 or 4, we go look at the other parent. The second feature of the parenting practices rating scale is a dimensional scale, 0 to 100, from neglectful, uninvolved parenting at the 0 end, all the way up to dominating and controlling parenting at the 100 end. And so just rate the parent along that dimensional scale. Now, in terms of my personal opinion about parenting and about this, if you're down at the 0 to 20 range on neglectful, uninvolved parenting, there's strong considerations about abusive neglect, abusive uninvolvement at the 0 to 20 range. When you're up at the 80 to 100 range on controlling, dominating parenting, I'm worried about violent, aggressive parenting up at that 80 to 100 range. So either side of that, the 0 to 20 scale or the 80 to 100 parts of the scale, I'm concerned. Those are pathogenic levels. Those are going to produce pathology in the child at those extremes. Now, healthy, normal range parent, I'd put anywhere from 40 to 60. I mean, Some people are more flexible, some are more negotiate, some people are more strict and rule bound, but it's entirely normal range. So 40 to 60, entirely normal range. What do we do about those transitional areas? That 20 to 40, 60 to 80 zone, those two little transitional areas, what do we do about those? Are those problematic or are those normal range? Here's my opinion about that. Here's my take on that. When it comes to parenting and families, I think it's a good idea for professional psychology to give a tremendous amount of latitude to parents to define the value systems within their families based on their personal values, based on their religious values, based on their cultural values. And so I am very reluctant as a clinical psychologist to pathologize parent choices in terms of parenting and the values within their family. So I will provide a considerable latitude to the prerogative of parents to define values within that are consistent with their religious beliefs, their personal beliefs, their cultural beliefs. And so I will take those kind of abusive domain or those concerns, and I'll bring it out a little bit to 25 to 75. But anything between 25 and 75 on my sort of subjective kind of rating scale here, I would consider normal range parenting. So 30, while it may be 30, may be a little more flexible, a little more negotiating with the child than I would hope for as a clinical psychologist, it's still normal range. A 70 might be a little more structured and rule-bound than I might like as a clinical psychologist, but it is still normal range. So there's a broad normal range in here, and that's that rating. Then we move into an empathy scale, 5-point empathy scale. On one end of the scale is narcissistic underinvolvement, the narcissistic absence of empathy. They just don't get it. There's just an absence of the ability to empathize with another person. That's the narcissistic side of the empathy dysfunction. The borderline side of the empathy dysfunction is an over-involvement, where it's not empathy with the child, it is projective identification. The parent is putting their experience into the child and calling that empathy. The child has the same experience as me. See, I have empathy. No, you're putting your experience into the child. That's the borderline side. So we have that over-involved intrusive side. We have the disengaged absence side of empathy, and normal's in the middle. Then the final piece of that parenting practices rating scale is just categorical indicators of concern. So if there's schizophrenia, parental bipolar disorder, untreated schizophrenia, untreated bipolar disorder. If you get treated bipolar disorder, that parent's totally, that's a non-issue, the bipolar disorder, if it's under treatment. Schizophrenia, under treatment. Depression, under treatment. If I have depression that's not being treated and not being managed, so I have a suicidal parent, that's a problem. Okay, that needs to be noted here. I've got a severely untreated, depressed parent. That's check. That's a problem. Substance abuse. Now, if that parent's clean and sober for a year, that's not a current issue. That's past. But if that's still active within this past year, then substance abuse is a parenting factor of concern, parental substance abuse. So all of those are just factors of concern that would merit noting on the assessment. So that's our assessment of pathogenic parenting by the targeted rejected parent. It's the documentation of our assessment by that parent. Are we getting pathogenic parenting that could account for the child's attachment system suppression? Now remember, the attachment system takes a pounding. So it is a neurologically embedded brain system that is always motivating the child to bond to the parent. It's a goal-corrected motivational system. It's motivating the child's bonding to the parent. And we are getting a severing of that attachment pathology. So that requires pretty significant pathogenic parenting to do that. So that's one zone. Now, if we come back off of our assessment that the targeted rejected parent is broadly normal range, that there's no pathogenic parenting I'm seeing from this parent, then our focus for assessing pathogenic parenting shifts over to the allied and supposedly favored parent. And so now we need to assess the pathogenic parenting or potential pathogenic parenting by an allied narcissistic borderline parent who's formed a cross-generational coalition with the child. So follow me over to the next video segment and we'll talk about that component of the assessment protocol.